Hello, this is Dr. Gay, and this is a patient who had profound ulnar side of weakness and can't even hold a glass. It hurts so much to flex the fingers. He had profound weakness in the fourth and fifth digits. He'd seen a couple medical professionals. The latest one he was referred to was a neurologist, and the neurologist had done a nerve conduction study and said that he did have an ulnar neuropathy. So the question was, why do you have the ulnar neuropathy? He came to us for an MRI, and on the MRI we see this dilated vessel over here. This is the palmar ulnar aspect, and this is the ulnar artery. And the ulnar artery is elongated and tortuous, makes a funny loop here, proximal to Guyon's canal. So the Guyon's canal, this is the pisiform bone right here, and the hamate bone is right here. We see it better on another sequence. So in this region, so it's proximal to that, we see this looped portion, and there's a little black line here, which is the ulnar artery that's getting displaced by this. I'll show you another picture here that shows this in better detail. Now here distally we see that the distal ulnar artery is also ectatic and has some tortuosity, and some of the distal vessels are also prominent. And I don't see a palmar arch going across here, so he may have hypothenar hammer syndrome, where instead of being compressed here by the pisiform bone in Guyon's canal or by the hook of the hamate bone, he may have had a prior occlusion there in the palmar arch possibly. And so he may need a vascular study, a CTA or angiogram to look at that. But other people I've seen with hypothenar hammer syndrome have had dissections or aneurysm right in this region here, adjacent to the pisiform or hamate bone. And this one again is neural compression here that I think would explain the ulnar neuropathy. This is the triangle of the fibrocartilage, looked great. And here's that ulnar artery again. This is a thinner images, smaller field of view with better image quality. We can see this ulnar artery going up, making a loop upon itself and going back up here again and ascending. And we can see here the hamate bone, the hook of the hamate bone, and the pisiform bone. So in this region, the Guyon's canal. But the vessel looked normal in that region. No aneurysm, no dissection that I could see. And you can see the ulnar nerve. So the ulnar nerve comes across right here, it's a bright band, and right here you can see it displaced and compressed a little bit by that loop of the artery. So I believe this may serve as etiology for the ulnar neuropathy right here. And also as it goes into Guyon's canal right here, you could argue that the ulnar artery is a little bit tortuous right here and it's pushing on the ulnar nerve as it goes into Guyon's canal. That's a softer call. So that is it. Thank you very much.